5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups, thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 9% of people over 70 have no idea they're being overested. One of these checkups, the number one on our list, actually causes 5% of all cancer cases in the U.S., which is equal to the number cases causes by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard, but the truth is buried in the science. Today, we're diving deep into the 5 health checkups you may want to rethink after age 70. Each one comes with risks few people talk about, and safer alternatives your doctor might not mention. So grab a cup of tea, settle in, and let's explore how to make smarter health choices for your golden years. Number 1. Bone Density Scan. A prescription for fear. Let's start with something that sounds completely benign, the DEXA scan. It's used to assess bone density and screen for osteoporosis. For women especially, this test becomes routine after menopause. But once you hit 70, this scan can lead you down a risky path. The test often finds osteopenia, a mild form of bone loss. But here's the catch. This is incredibly common and often harmless at this age. Despite that many seniors are prescribed strong medications, like bisphosphonates, which can cause serious side effects, including jawbone death and esophageal irritation. Take Rose, a 76-year-old retired piano teacher. Her DEXA scan showed osteopenia. She was prescribed medication and soon suffered from jaw pain and digestive issues so severe she stopped playing piano altogether. It wasn't until she quit the meds and focused on weight-bearing exercises and a calcium-rich diet that she regained her strength and balance. What to do instead? Unless you've had frequent falls or fractures, focus on resistance training, vitamin D, and calcium from food. According to the journal Osteoporosis International, these steps can reduce fracture risk by over 20%. No prescription required. Number 2. Brain. RI for mild memory loss. Forgetfulness happens. You misplace keys, forget names, walk into a room and can't remember why. For many seniors, that sparks fear of dementia. Doctors often respond with a brain MRI. But MRIs frequently reveal age-related changes that have nothing to do with Alzheimer's. Here's the problem. Once a scan shows white matter spots or slight shrinkage, both normal after 70, it can lead to panic, misdiagnosis, and even unnecessary surgery. George, 74, feared his occasional forgetfulness was dementia. An MRI showed white matter changes and panic set in. He withdrew from social events, stopped driving, and spiraled into anxiety. Yet a cognitive screening later showed he was functioning well. He didn't need an MRI. He needed reassurance, hydration, better sleep, and cognitive stimulation. What to do instead? If you or a loved one are concerned about memory, start with a paper-based cognitive screening test. It's safe, cheap, and accurate. Only pursue imaging if there are serious symptoms like seizures or sudden mental decline. Number 3. Cardiac stress tests. A little chest tightness. Mild fatigue. Your doctor orders a cardiac stress test. Seems logical, right? But in people over 70, This test is notoriously unreliable. Why? Because it has a false positive rate of up to 1%. That means almost half the time it suggests heart trouble when there isn't any, and that often leads to dangerous procedures. Raymond, to 75, was active and walked daily. A stress test for minor fatigue led to a catheterization, a stent placement, and kidney complications from the contrast dye. He spent a week in the hospital, all for something that likely wasn't heart-related. Instead, opt for safer tests like an EKG or coronary calcium scan. These carry far fewer risks and can give a clearer picture of heart health without the domino effect of invasive follow-ups. Number 4. Colonoscopy. Is the risk worth it? After 75. Here's a surprise. One of the most common screenings may not be worth the trouble once you pass 70. Colonoscopy is the gold standard for detecting colon cancer. But after 75, the risks increase dramatically. Harsh prep, dehydration, sedation, related memory issues, and the potential for bowel perforation all make it a high-stakes procedure for older adults. Dana, 73, had no symptoms and no family history. Her routine colonoscopy ended in a perforated bowel and a 9-day hospital stay. The polyp they removed, harmless. The damage, long-lasting. Current guidelines suggest stopping routine colonoscopy at 75. Instead, ask about the FIT test, a simple at-home stool test that can catch early signs of cancer with zero prep and no sedation. Number 5. Full-body CT scans. It sounds high-tech and proactive. A full-body scan to catch cancer early. But here's the dark truth. These scans expose your body to massive doses of radiation, up to 500 chest X-rays worth. According to JAMA Internal Medicine, these scans may cause up to 5% of all cancers in the U.S. That's the same risk you'd get from drinking alcohol every day. Marcus, 80, was in excellent health. His scan found a tiny nodule. What followed was a chain of biopsies, hospitalization, and lung complications. The nodule, benign. These scans find incidentalomas, non-issues that trigger panic and aggressive, unnecessary treatments. Leading experts advise against using full-body scans for general screening in people without symptoms. What to do instead? Listen to your body. If you have real symptoms like unexplained weight loss, persistent cough, or changes in bowel habits, targeted imaging makes sense. Otherwise, skip the scans and stick to a sensible prevention plan built around real needs. If you're over 70, remember this. More testing does not always equal better health. In fact, it may lead to worse outcomes, more fear, and irreversible damage. Ask your doctor questions. Challenge the idea that every test is necessary. Demand to know what are the risks. What are the alternatives? What happens if we do nothing right now? Real prevention starts with smart choices, nutritious food, regular movement, restful sleep, and meaningful connection. Choose checkups that support your health, not ones that gamble with it.